Hey everyone, welcome to this episode of Compassion and Courage, Conversations in Healthcare. I am your host, Marcus Engel, and this is the podcast where I teach compassionate communication, provide perspective, and inspire resilience. Today, I am super excited to get to interview not only an incredible healthcare professional, an incredible doctor, but also someone who I've known for nearly 3 decades and someone who I now get to call my friend. And that is Dr. Timothy Jones. Dr. Jones, welcome to the podcast.
Thank you, Marcus. It's a pleasure to be here. I'm honored.
Well, I'm glad to talk to you as always. And whenever I introduce you people, a lot of times they're folks that people haven't heard of. However, if people have read any one of my books, I'm holding after this up to the camera right now. If people have read after this, if you have read I'm Here or The Other End of the Stethoscope, you will have already read about Dr. Jones. Dr. Jones was the primary plastic surgeon for me during my recovery, and so I'd like to take you back, if I could, Doc, to you back in the fall of '93 when you and I first came into contact with one another. So prior to that, you originally from Oklahoma, right? And went to college in Oklahoma,
Right.
med school in Oklahoma. Then you went around the country, picked up a whole bunch of residencies and fellowships, and so then we come into the fall of '93. You're working at Barnes Hospital in St. Louis. Take me back to the first time that you and I interacted with one another.
Well, it was late at night, one fall evening. I got a call from the emergency room at Barnes Hospital. Had a plastic surgery resident on call. I believe his name was David Martin. And David called me explaining there was a terrible motor vehicle accident, and he was essentially describing the injuries that happened to you. And these were really horrific injuries. I mean, to this day, I think I've not seen anybody injured so severely in their face and not have a direct injury to their brain as you did. And it was so fortunate that it spared your brain, and I thought you would, at that time, wouldn't make it. And that was how we first met.
So when you first saw me, what was the diagnosis that you gave to the resident, to whoever else was around? What is that diagnosis for the medical and healthcare folks in the audience?
Well, you had been an unrestrained passenger in a car wreck and flown out of the car through the windshield. And essentially, I believe you hit the dashboard probably with your nose and your eyes, and it had produced a fracture of the bones of your face, the bones that contain, between the base of your skull and your upper teeth were all just pulverized, really, and you'd broken the mandible, the lower jaw, and you'd also had injury to, part of the skull on the side that affected your facial nerve and your hearing. But most of all at that time is your eyes had been severely injured. And at that time, the ophthalmologists were the ones who really were initially seeing you because we wanted to try and spare the vision at all cost. And so that really took priority over fixing the bones and the other soft tissue injuries. That took a couple days really to declare. And once we had declared that wasn't going to be successful, then everything was then focused on how do we put you back together again. And that was a multifaceted approach with several specialists and a lot of planning.
And I feel so fortunate that it was you who was there that night because having served residencies in both plastics and ENT, correct? At that point in time, you kind of draw the
Correct.
short straw. There's not that many people who could take care of such a severe facial injury.
Well, I mean that's true, Marcus. But I'd spent my entire life training for that kind of an event, and that um, when I went into medicine initially, I went into ear, nose, and throat, and I was fascinated by working on the face. And what really was I found challenging is you could do all these surgeries, but really the challenge was, how do you reconstruct things? And so that was the reason I did plastic surgery training, and I really enjoyed doing it. So you're exactly right. Our meeting was really timely, and I felt really fortunate to be at Barnes Hospital in Washington University. Is a great medical center, had great help, and a great other specialists that was able to give you, I think, the best care possible at that time.
When I think about the amount of damage that was done and the hours and hours and hours that you spent working on me, to think that we were able to get a face back together that can smile and eat and breathe and feel, that is a lot of work. And whenever I describe to people the hundreds of hours of procedures and surgery, I think that's a little hard for people to comprehend. And you've been in this field now for how long? 35 years or so?
Since 1991 is when I finished, but you start when you're young in the 80s, but yeah, about 35 years operating. And it's interesting that I'm starting to feel it now. Those operations that you operate all day for 8 hours, 10 hours, you start to feel. But back then I was in my 30s. It does take a lot of mental and physical endurance. And part of the training, I really think, is being able to focus mentally on what you're doing, and sort of push on through those kind of things, and trying to make the best of it, and really do a good job. So it was a real tour de force, and I'm glad to say I haven't had anything more challenging.
I'm glad to hear that you haven't had anything more challenging because that would mean a lot more suffering in the world. I definitely remember, and I often tell people the story about what my family still refers to as my first big surgery. And I remember coming out of that surgery, and I remember being in the recovery room. I remember my aunt being there and telling me that the surgery had lasted 20 hours. And I remember afterwards my parents telling me that they talked to you after surgery and they said Dr. Jones looked really tired. And I can only imagine the marathon that had to be physically standing over an OR table for that long. And obviously there are breaks in there, but that's a long time. And you say you have not done anything since that would be that extensive.
I don't think I have, not for that period of time, but I mean, my time at Washington University was spent doing long operations, and whether it was from trauma or for cancer, but that's sort of the nature of the beast of reconstruction when you're doing those kind of things. And it's it's a real tour de force to do those kind of things, but you have good help, and that's so helpful.
Yeah, I remember many of the residents that you had under you that were working on me, and I feel fortunate that the world is now full of a lot more plastic surgeons and ENTs that had your guidance through those kind of times. I want to ask you a question about your training and your education. When you were in medical school and when you were going through residencies, etc., what kind of training or education did you have in compassion and communication with patients and families?
Well, you have psychiatry, I believe, is what would be the closest to really talking about mental health, communication, and perhaps one of the most enjoyable classes I had in medical school was psychiatry. It was taught by a professor called Gordon Deckert, and he would for 2 hours he would act out different emotions of people as a way of teaching. He would do that, teaching anger, denial, different personality problems, and it was fascinating. It was like going to the movie for 2 hours. You would just sit there in awe because he would act out these people and emulate them, and it was fascinating. And so you learn about death and dying, and sexual problems, mental health problems. I don't know if you really get instructed on how do you communicate with patients as well. I mean, different things to help you connect with patients. I think we're becoming more aware of that. Patients come from different backgrounds. They have different cultures and things like that. That really isn't taught as much back then as it, I think, is emphasized now. But there's always been, instruction and I think emphasis on trying to treat the patient as a real person and not just a disease.
And of course, I am so glad to hear that. And I received that from you. I know that my family received that personalized care from you. And I often share the stories about how your interactions with me were incredibly empathetic, especially taking care of such a angry young man who was so messed up. There were so many different things to contend with. Um, I guess I'm wondering how did you know how to do that? How did you know how to handle someone lashing out at you, and how do you react with compassion, or how do you respond with compassion instead of react with judgment or anger? What's the basis for that?
Well, that's a really great question, Marcus. My time taking care of you was emotionally very challenging. Not only physically and taking care, but emotionally, just because I could identify with the injury you had sustained. I mean, I could see me being in your shoes at 19 years of age. I could identify with you and your personality, where you came from, where your parents were, and it was just emotionally challenging to do that. And I remember you yelling at me, and I my only thought was just listen and let the vent happen. In a way, I was enraged also, because it was hard, and so I mean. That I remember that very vividly to that day, and there were times. I remember specifically one time leaving the room and just losing it somewhere else, and thinking, "Oh my God, what would happen to you? I mean, how would you handle this?"
And you were
And
a young father at the time too, so you're relating to the
right,
parental aspect.
I had 3 children. My youngest son had just been born a couple months earlier. And so it was emotionally challenging to do that. But it taught me a great amount of how to take care of people in those kind of catastrophic events. And even I would say over the 30 years since you have recovered and gone on to be sitting where you are right now, I've learned so much from my interactions with you in that event those days and going forward. And when I see, what you produce now, even with this podcast, I mean, it's a misfortune what happened to it, but what you have produced from this is just outstanding. And I know everyone is so proud to see what you've accomplished and how you have endured and the resilience that you've shown. All that stuff really gives meaning to what I do, and makes you try and smell the roses a little bit. And there's even a couple years ago, I remember when you came, I saw you speak. I believe it was in my hometown in Shawnee, Oklahoma. And you said something that I think I'd heard you say before, but it really makes me think again. And I think this every time when I see a patient, is that people who are hurting hurt.
Hurting people hurt people.
They do. And that is so pertinent in medicine, because people who come to see me, I mean, just by the definition, they have dis-ease. They have disease, which means they're not at ease. And either they're anxious, or they could be depressed, or they're scared, or feel. But I think if you keep that in mind, it allows you to understand why they're behaving that way, and to recognize it, and to help deal with it.
Yes, I agreed, and I think that you seem to have a deeper understanding of that than maybe some of my other docs and surgeons during that time. That this was you could empathize, you could put yourself back into the shoes of a 18, 20-year-old kid who is so helpless and hurt. And because of that, I think the little things that you just did, helping me have some dignity and not judgment or punishment for my outbursts, that was such an act of compassion to me. Not to have, I often say that the opposite, much like the opposite of love is not hate, the opposite of love is apathy. The opposite of compassion is not cruelty. The opposite of compassion is judgment. And I remember a few different docs that I had that would punish me, scold me for my outbursts, and you never did that. And thank you for not doing that. I think scolding someone at such a vulnerable time doesn't really doesn't help. Doesn't help a lot. I also get to tell people the stories because I often get the question, okay, Marcus, for those of us who have never worked with someone who is blind, what are the things that we can do to help and not hurt? And I think many of those things I learned from you, but you were probably learning by trial and error too. I have to imagine that I was one of your first patients who was blind.
What are some of those? And you're right, it was trial and error. Well, first of all, you have to tell people what you're doing. And the other thing is you have to tell them when you're going to touch them. And, after that, things went pretty well. But even now when, I say I look in someone's nose, for instance, they'll usually shut their eyes and they'll jump and they're scared. But communicating and let them know what you're doing and when you're going to touch them and where, then everyone gets comfortable with that.
It's a heads up, right? It's a heads up, just that,
Yeah, exactly.
so that there's not the startle aspect.
Yeah.
And I've never come across a doctor in my now, 28, 30 years of being a patient that has ever been able to communicate with me as well as you have about the instances that you're going to touch me. Thank you for always recognizing that. Yeah, yeah. So I'd like to ask you some questions. We talk about the compassion that you showed to me and to my family. One of the questions that I often ask my pre-meds at Notre Dame when I'm communicating with them is how did you get interested in medicine in the first place? Did you come from a healthcare family? Do you have parents who were docs? Can you give us a little bit of your background and how this came as the profession to you?
Sure. I was almost indoctrinated into medicine. My dad was a pediatrician. He was the first board certified pediatrician in our little town of Shawnee, Oklahoma, and my mother was a registered nurse. And he started practicing in the 60s. That was in the day that before pagers, before cell phones. And so when a mother would be calling about their child, they would call our house. And I had two other brothers and a sisters, and we were basically the receptionists for, after hours. And my mother actually was a nurse, worked in his office for a while. And so being around medicine was very natural. My dad's family was in town, and so he had a brother who would come over and want to be treated, but I would have the parents of my best friends call wanting to get some treatment for friend's sore throat. And so that came very natural. And then, my two other brothers and sisters really, I guess, weren't as interested in medicine. But anyway, I used to go to the hospital with him and make rounds. And I just enjoyed it. I had, as a young kid, I had my tonsils removed, and that was not a bad experience. And so I learned early on, really, in probably junior high, that I was going to go into medicine, and just sort of pursued it after that. Really, starting after high school, I won a state championship in tennis in high school, and reflected back saying, well, what are you going to do with the rest of your life? And then just sort of turned all my attention to medicine and went to medical school, knowing I wanted to be a physician, not a pediatrician, but probably some kind of surgical specialist. And then going through medical school, the way I got interested in ENT, we had a visiting professor the second year. They would get certain physicians out in the community to come by and tell you about what the field was like. And this was a guy named Raymond Smith who showed a photograph of a lady with sinus cancer, and he resected that by really splitting her face in two and taking it out. And then when he got finished, she looked perfectly normal, and I said, that is such a cool thing to do. I'd love to do that. And that's sort of how I got started into ENT. And then after, otolaryngology and the ear, nose, and throat, I said, well, it's the reconstructive part that really fascinated me. And so that's how I went down that trail of plastic surgery and reconstruction.
And I am the beneficiary of that first interest that you were shown by the doctor who did that surgery. I'm very grateful to him for inspiring you to go into this field. So I get out of the hospital, and You and I stay acquainted for years because every couple of years I need to come back in and have some kind of revision or cosmetic something done. Um, and then that kind of brings us up to the last several years, and this has taken. I think in the last couple of years, our relationship has grown from that of doctor and patient to I don't want to say colleagues, but certainly something deeper than just doctor and patient. And I'm grateful for your friendship. And I'd also like to ask you if you could to tell us a little bit about the last few years and what has come from that, if you feel comfortable doing that.
Well, sure. Oh, I guess now it's been 2017 where my youngest son, Mitchell, took his own life. And, you know, that was unfortunate, but the other part of that story is that I come from a family where they've taken their life. Suicide's been a loss of life for my grandmother, my maternal grandmother I never knew, my mom when I was age 14, and then my son Mitchell, who was 24. And I mean, it's clear to I think everyone now, and it's been brought into sharper focus by all the mental health problems and the high suicide rate that's happened with COVID and how to treat that we're simply not doing a good job taking care of mental health issues. And the suicide rate is the highest it's ever been. It's the number 2 killer in the age group from 10 to 34. Suicide killed more young people than the COVID infection did. And even before we had this problem, I don't think mental health has gotten the priority it needs. I mean, if we have, any other entity, we have disease entity, you might say heart disease, we have the American Heart Association, we have the American Lung Association, but we don't really have strong nonprofits advocating for mental health disease. And when you look in the Forbes top 100 nonprofits, there's only really 2 I could find that dealt with mental health and mental disease. One was Alzheimer's, and the other one dealt with mental health. But I think it's a priority that needs more attention, needs more funding, and the way we approach it needs to change. There's always been a stigma about people with mental health problems and suicide, and people don't talk about that. And I think it's important that we do start talking about it and people understand how to help people with that, maybe what to say, what not to say. And it's not easy. It's a frustrating disease, and the patients are challenging. And so that's the basis of me starting a foundation called the Mom and Mitchell Foundation. It's really a nonprofit to do something to foster mental health wellness and to help prevent suicide. And it really starts with conversation, awareness, and trying to find out what we can do to get people who need help, and not only people who might have mental health disorders or disease, but how do we keep people healthy? How do we decrease the volume of the monsters in your head? And how do we stay mentally focused and mentally healthy and resilient? Everyone has anxiety. Depression happens all the time, but we need tools. We need to sharpen those tools so we can bounce back. And it's getting tougher and tougher. And I think one of the bigger challenges that we've seen come lately is social media. And there are a lot of young people who are adversely affected with bullying and social media. and we're seeing all these kind of statistics rise, and so that's really what I want to try and do with this foundation. The purpose of it is do what really the Komen Foundation did for breast cancer with the ribbons. That needs to happen for mental health, and so that's the goal.
Thank you, and I hope I speak for not only myself but everyone who's listening when we extend sympathy and peace for the way suicide has touched so generations of your family. I feel like in my work, one of the things that I help people focus on is redemption. And I think we're all looking for redemption when something has tragically touched our lives. What can we do to try to help other people who might have the same experience, or to keep something like this from happening to somebody else? That's the redemption, and I'm so glad that you started this foundation. I think we can tell people that I'm one of your board members, and I'm really excited to see how this will have real application to people who are hurting and people who are struggling. Tell us about your big upcoming event.
Oh, good. You'd love to. Well, first of all, you're absolutely right about redemption, Marcus, because and that sort of is going to carry on to this event. So there, since my son died back in 2017, I always knew I wanted to do something. And I mean, how can you help? What to do? How do you do it? How do you raise money for a nonprofit? And just a little over a year ago, one of my best friends through life, his name is Brett Bowers. We grew up from age 5 until he died last year. And we went through grade school, high school together. We won a state championship in tennis together. We were college roommates together. And throughout our adult life, we stayed in touch. He would stay in touch. We talked all the time. And even like when I was young in high school and my mom died, he was there for me. He was there. And when Mitchell died, he was there. He died unexpectedly in last February of a heart attack, probably a complication of COVID. Then people who get COVID are 6 times more likely to have blood clots go to their heart and their brain. And he came back from running, had a heart attack, and died. And that was devastating. I mean, he was getting ready to retire, very healthy otherwise. And that's what I thought that what we would do is start the nonprofit foundation using a golf event, a two-person scramble, because we played tennis together, we golfed together, and golf is a way that you can relax and have conversation. Usually relax, but if you're out, and so Brett was a friend not only to me but everyone. He would call everybody on their birthday. He was someone who would reach out to you. And if you remember, there's a great movie with Jimmy Stewart in it that we all watch at Christmas. It's gosh, I'm blanking on
It's a Wonderful Life.
Thank you. It's a Wonderful Life. And in The Wonderful Life, when Jimmy Stewart he plays a banker and he's contemplating suicide, and all of a sudden his guardian angel, Clarence Oddbody, appears and jumps into the river to save him. And so Brett was sort of my Clarence in life. He was always there when you needed him, and he would show up. You didn't have to call or do anything. He had my back. And so this is a golf event that's going to be our main fundraiser for the Mom and Mitchell Foundation. That takes place on Monday, June 6th. It's a two-person scramble at the Greens Country Club in Oklahoma City. We love to have golfers, but we also they have a very nice pool, and for non-golfers who want to just hang out and be a day at a pool, that's available. And we're going to have a dinner and silent auction and a wonderful speech by you. And we're just excited to get this organized and have you be a part of that and really be a part of what we're doing, because you bring so much insight into what we're doing, and I'm really appreciative.
As someone who has contemplated ending my own life at a time or two, I know that the reasons that I did not were because of social connection, because of having a Clarence in my life, somebody who was absolutely there for me during those times. And I love the idea that you're doing this in Brett's memory, and the foundation in the memory of your mom and your son. And I'm really looking forward to seeing how we really apply this to people's lives. I love golf tournaments. I look forward to being out there that day. But really, what I'm excited about is what do we do with the resources that are raised, and how do we make sure that no one else has to suffer through a tragedy like those that you've suffered through.
Well, you're exactly right, and it'll be exciting to brainstorm with people like you, other people in the education field, the psychology field. We really need to rethink our approaches to mental health problems, and so this really has given me redemption, as you say, as trying to feel good about it, and it has.
Yeah, anytime that we can do something that in any way helps a memory live on, or a mission be founded, I think that's one of the greatest things that we can do is to try to take those tragedies that we've experienced and turn them into something that helps or teaches others. So June 6th, Oklahoma City. If anybody is interested, they can go to the website again is
momandmitchell.org.
momandmitchell.org. Okay, make sure I get that right. momandmitchell.org. I'm really looking forward to it. I cannot thank you enough for spending some time with me today. I can't thank you enough for the efforts that you're making to help ease the suffering of those who are struggling with mental illness. And of course, I cannot thank you enough for putting me back together again so many years ago, and being my a constant companion through life now. Thank you.
You're welcome, and thank you for what you've done for me, Marcus.
It's what we get to do. It's what we get to do in life, right? It's what we get to do.
That's right. That's right.
All right. Well, thank you so much.
That's how it is.
Well, thank you so much, Dr. Timothy Jones, for being with us today on Compassion and Courage. And for all of those who are listening and enjoying the podcast, please rate and review, subscribe, share, comment, do all of the social media things out there. And we will see you next time on the next episode of Compassion and Courage.
Thank you, Marcus.